everybody. With just a month to go until Election Day, I know you've all been hearing a lot about politics out here in Virginia. I know you've been seeing a lot of ads. You've been getting a lot of calls. You've been reading a lot about this election in the newspaper. But being here today to talk to you about health care, that's what I'm going to talk about today, the health care crisis. This isn't politics for me. This is personal. I'm thinking today about my mother. She died of ovarian cancer at the age of 53. She fought valiantly. She endured the pain and chemotherapy with grace and good humor. But I'll never forget how she spent her final months of her life. At a time when she should have been focused on getting well. At a time when she should have been taking stock of her life and taking comfort from her family. She was lying in a hospital bed fighting with her insurance company because they didn't want to cover her treatment. They claimed that her cancer was a pre-existing condition, and so maybe they didn't have to pay. So I know something about the heartbreak caused not just by a loved one being sick, but by our broken healthcare system. I know something about the anxiety of families hanging on by a thread as premiums have doubled these past 8 years. They're going into debt, and more than half of all personal bankruptcies caused in part by medical bills. I know about the frustration of nearly 40% of small business owners who can no longer afford to insure their employees. Folks who work day and night, but have to lay people off or shut their doors for good because of rising healthcare costs. I know the outrage we all feel about 45 million Americans who don't have health insurance. Kids who can't see a doctor when they're sick. Parents cutting their pills in half and praying for the best. Folks who wind up in the emergency room in the middle of the night because they've got nowhere else to turn. I know this is not who we are. This is not who we are as Americans. We're not a country where young women I met should have to work the night shift after a full day of college and still not be able to pay the medical bills for her sister who's ill. That's not right. That's not who we are. America's not a country where I should be meeting a man who had to file for bankruptcy after he had a stroke because he faced nearly $200,000 in medical costs that he couldn't afford and his insurance company didn't cover. That's not right. That's not who we are. Not only is it not right, it ain't right. We aren't a country that rewards hard work and perseverance with debt and with worry. We've never been a country that lets major challenges go unsolved and unaddressed. And we are tired of watching as year after year, candidates offer up detailed health care plans with great fanfare and promise, only to see them crushed under the weight of Washington politics and drug and insurance lobbying once the campaign is over. That is not who we are. That is not who we have to be. Enough is enough. It is time for us to change. We know that change is possible. We've seen it across this country as governors and legislatures have moved ahead of Washington to pass bold health care initiatives on their own. We see people across the spectrum, doctors and patients, unions and businesses, Democrats, Republicans, nurses, coming together around this issue because at a time when rising costs have put too many families and businesses on a collision course with financial ruin, left too many without coverage at all, they know that Band-Aids and half measures just won't do. All of you know it as well. Let me see a show of hands. How many people don't have health insurance? How many people know somebody who doesn't have health insurance? How many people have seen a family member or themselves denied because they said it was a pre-existing condition? Everybody knows that the healthcare system's not working. Now, I know at this moment, when we stand in the midst of a serious economic crisis, some might ask, how can we afford to focus on healthcare? We just had this big rescue package. Unemployment is up. The economy is weakening. Well, let's be clear. The rescue package we just passed in Congress isn't the end of what we need to do to fix our economy. It's just the beginning of what we need to do to fix our economy. Because contrary to what my opponent, John McCain, says, the fundamentals of our economy are not strong. The fundamentals of our economy are weak, and we've got to address those fundamentals and address them right now. In other words, the question isn't how we can afford to focus on healthcare. The question is, how can we afford not to? Because in order to fix our economic crisis and rebuild our middle class, we need to fix our healthcare system too. Let's not forget, it's not just small businesses and families who are struggling. Some of the largest corporations in America, including major American auto manufacturers, are struggling right now to compete in the global marketplace because of high healthcare costs. They're watching their foreign competitors prosper unburdened by these costs, as they struggle to create the good jobs that we need to get our economy back on track. So it's time to do something different. It is clear that the time has come right now to solve this problem, to cut healthcare costs for families and businesses and provide affordable, accessible health insurance for every single American. That's one of the reasons that I'm running for President of the United States of America. You'd think that anyone running for president would understand this. You'd think any candidate for the highest office in the land would have a plan to achieve these critically important goals. Well, if you think that, you haven't met my opponent, Senator John McCain. Now, I'm not saying that he doesn't care about what people are going through. I just think he doesn't know. That's the only reason I can think of that he'd propose a health care plan that is so radical, so out of touch with what you're facing, so out of line with our basic values. Senator McCain's been eager to share some of the details of his plan, but not all of the details. He tells you that he'll give you a tax credit of $2,500 per person, $5,000 per family, to help you pay for your insurance and health care costs. Sounds good, right? But like those ads for prescription drugs, you've got to read the fine print to learn the rest of the story, to find out the side effects. You see, Senator McCain would pay for his plan, in part, by taxing your health care benefits for the first time in history. I want everybody to be clear about this. This tax would come out of your paycheck. So if you make $40,000 a year and you've got a health care plan that costs your employer $10,000, now instead of being taxed on $40,000, you're going to be taxed on $50,000. Your taxes go up under his plan. What about the new tax credit he's proposing? That wouldn't go to you. It would go directly to your insurance company, not your bank account. So when you read the fine print, it's clear that John McCain is pulling an old Washington bait and switch. It's a shell game. He gives you a tax credit with one hand, but he raises your taxes with the other. And recently, after some forceful questioning on TV, he finally admitted that for some Americans, those with the best plans, his tax increase would be higher than his tax credit. So they'll come out behind. John McCain calls these plans Cadillac plans. Now, in some cases, it may be that a corporate CEO is getting too good a deal. But what if you're a line worker making a good American car like the Cadillac? What if you're one of the steel workers who are working right here in Newport News? And you've given up wage increases in exchange for better health care. Well, Senator McCain believes you should pay higher taxes too. The bottom line, the better your health care plan, the harder you fought for your good benefits, the higher the taxes you'll pay under John McCain's plan. And here's something else Senator McCain won't tell you. When he taxes people benefits, many younger, healthier workers will decide it's better for them to just opt out of getting insurance at the places where they work. Instead, they'll go out to the individual market because they're healthy, they can buy a cheaper plan. What that means is many employers will be left with an older, sicker pool of workers who they can't afford to cover. So as a result, many employers will drop their health care plans altogether. Study after study has shown that under the McCain plan, at least 20 million Americans will lose the insurance they rely on from their workplace. It's the same approach George W. Bush floated a few years ago. It was dead on arrival in Congress, and for good reason. But if Senator McCain were to succeed where George Bush failed, it very well could be the beginning of the end of our employer-based healthcare system. In fact, some experts have said that that's exactly the point of John McCain's plan, to drive you out of the insurance that you have through your employer and out into the marketplace where your family will be given that $5,000 tax credit and told to buy insurance on your own. $5,000 tax credit sounds good, but what Senator McCain doesn't tell you is the average cost of a family health care plan these days is more than twice that much. It's $12,680. So where would that leave you? Broke. Senator McCain also doesn't tell you that insurance in the individual market isn't just more expensive than insurance you get through work, it also includes fewer benefits. For example, many of these plans that you've got to buy on your own instead of getting it through your employer, they don't cover prescription drugs. They don't cover prenatal care. Many don't cover birth. So you'd have to pay that out of pocket, roughly $6,000. That ain't right. When you're out there fending for yourself against the insurance companies, you pay more and you get less. Here's another thing Senator McCain doesn't tell you. His plan won't do a thing to stop insurance companies from discriminating against you if you've got a pre-existing condition, like hypertension, or asthma, or diabetes, or cancer, the kind of conditions that 65 million working Americans suffer from. People from all backgrounds and walks of life all across this country. Ain't right? Employers don't charge you higher premiums for these conditions, but insurers do, much higher. So the sicker you've been, the more you'll have to pay. The harder you'll be able to take care of your need. Finally, what John McCain doesn't tell you is that his plan calls for massive deregulation of the insurance industry that would leave families without the basic protections you rely on. You may have heard about how in the current issue of a magazine, Senator McCain wrote, "We need to open up healthcare to," and I'm quoting him, "more vigorous nationwide competition as we have done over the last decade in banking." That's right. John McCain wants to deregulate the insurance industry just like he fought to deregulate the banking industry. And we've seen how well that worked out. It would be equally catastrophic for your health care. Right now, different states have different rules about what insurance companies have to cover. Senator McCain's plan would create a deregulated national market where companies could cherry pick the states where they're based and sell plans anywhere in America. That's the starting gun for a race to the bottom. Insurance companies will rush to set up shop in the states with the fewest protections for patients. States where they don't have to cover things like mammograms and other cancer screenings, vaccinations, maternity care, mental health care. States where you don't have the right to appeal when your HMO refuses to cover the treatment that you need. These are common sense protections to make sure that you and your doctor, not insurance company bureaucrats, are making decisions about your health care, and John McCain wants to give insurance companies free rein to avoid them. That ain't right. And believe it or not, Just to top it all off, Senator McCain plans to give the top 10 largest insurance companies $2 billion in new tax cuts. So, anyone want to guess who's running and funding John McCain's campaign? I'll give you a hint. Remember when we tried to fix health care back in the 1990s? And the insurance companies spent millions running misleading ads to scare people into opposing reform? That's right, John McCain has lobbyists for 69 insurance and drug companies and trade groups advising his campaign, writing his policies, raising him money. 3 of them are his top advisors. And if you think that Washington lobbyists who are working day and night to elect John McCain are doing it to put themselves out of business, well, I've got a bridge in Alaska to sell you. So, listen up. I want people to understand this. Here's John McCain's radical plan in a nutshell. He taxes health care benefits for the first time in history. Millions lose the health care they have. Millions pay more for the health care they get. Drug and insurance companies continue to make exorbitant profits, and middle-class families watch the system they rely on begin to unravel before their eyes. Well, I don't think that's right. I'm pretty sure it ain't right. I don't think we should settle for health care that works better for drug and insurance companies than it does for hard-working Americans. I don't think that's the change we need. We can do better than that. In the end, it's not surprising that Senator McCain's plan isn't a vast improvement over the same failed policies of these past 8 years. Because remember, Senator McCain voted against expanding the Children's Health Insurance Program, a program that provides health care for millions of children in need. He voted against protecting Medicare 40 times over the course of his career. He supported a massive cut in Medicare that would have raised premiums and out-of-pocket expenses for seniors while weakening the care they depend on. In other words, Senator McCain's plan reflects the same bankrupt philosophy that he's been subscribing to for the past 3 decades in Washington. The same attitude that helped to lead to this crisis on Wall Street. The attitude that we're going to take care of the healthy and the wealthy. And good luck to everybody else. They call it the ownership society, but what it really means is you're on your own. Your job doesn't have health care? Don't worry, the market will fix it. You're on your own. You got a pre-existing condition? Tough luck. You're on your own. Insurance company won't pay for your treatment? Too bad. You're on your own. This approach has not worked these past 8 years. There's no reason to think it's going to work now. It is time to turn the page, and that's why I'm running for president of the United States. We don't need somebody to dust off some old, stale Bush proposal and call it reform. We need something new. Now let me be clear. I don't think government can solve all our problems, but I reject the radical idea that government has no role to play in protecting ordinary Americans. I reject the thinking that says preserving our free market means letting corporations and special interests do what they please and run roughshod over ordinary Americans. I don't think it's right when middle-class folks work hard and still don't have health insurance. I know that nothing is more important than the health and well-being of the people you love. You know, I have 2 daughters. I think about if I were a parent and I wasn't sure that I could provide health care for those kids, I don't know what I'd do. If you work hard and do everything right, you shouldn't live in fear of losing everything because of a fluke of genetics or a bad diagnosis or a stroke of bad luck. That's why I believe that every single American has the right to affordable, accessible health care. A right that should never be subject to Washington politics or industry profiteering, and that should never be purchased with tax increases on middle-class families, because that is the last thing we need in an economy like this. Folks are already having a tough enough time. I know we can do this. I know what we can accomplish when we come together. I saw it in Illinois when, as a state senator, I brought Republicans and Democrats together to pass legislation that has expanded coverage to more than 150,000 people, including 70,000 children. I helped expand coverage for routine mammograms for women on Medicaid. We created hospital report cards so that every consumer could see things like the ratio of nurses to patients, the number of annual medical errors, and the quality of health care that they could expect at each hospital, so that you were an informed consumer. So I reject the tired old debate that says we have to choose between 2 extremes: government-run health care with higher taxes, or insurance companies without rules denying people coverage. That's a false choice. The same distracting rhetoric that kept us gridlocked for decades. And we know that neither of these approaches is the answer to this problem. The real solution is to take on drug and insurance companies, modernize our healthcare system for the 21st century, reduce costs for families and businesses, and finally provide affordable, accessible healthcare for every single American. And that's what I intend to do as President of the United States. Now, I understand it's easy to have good ideas and make big promises. You've heard plenty of those in the past 20 months. The hard part is coming up with a concrete, detailed plan and translating that plan into action. So today I want to take a few minutes to tell you exactly how I plan to do what I've promised, how I will get it done, how I'm going to pay for it. So be patient with me, just listen up. We will start by reducing premiums by as much as $2,500 per family. And we'll do it by taking the following 5 steps to lower costs throughout our healthcare system. First, we'll take on the drug and insurance companies and hold them accountable for the prices they charge and the harm that they cause. We'll start by increasing competition in the insurance industry, outlawing insurance company discrimination against people with pre-existing conditions. Insurance companies spend $50 billion a year on elaborate efforts to cherry-pick the healthiest patients and avoid covering everybody else. I intend to save them a whole lot of time and money by putting an end to this practice once and for all. Then we'll tell the pharmaceutical companies, thanks, but no thanks for overpriced drugs. Drugs that cost twice as much here as they do in Europe and Canada and Mexico. We'll let Medicare negotiate for lower prices. We'll stop drug companies from blocking generic drugs that are just as effective and far less expensive. We'll allow the safe reimportation of low-cost drugs from countries like Canada. Number 2, we're going to focus on prevention, on promoting wellness rather than just managing sickness. Today, we spend less than 4 cents of every healthcare dollar on prevention and public health, even though 80% of risk factors involved in the leading causes of death are behavior-related and therefore preventable. So under my plan, we'll make sure insurance companies have to cover evidence-based preventive care services, weight loss programs, smoking cessation programs, other efforts to help people avoid costly, debilitating health problems in the first place. That's number 2. Number 3, you still with me? Number three, we will reduce waste and inefficiency by moving from a 20th century healthcare system based on pen and paper to a 21st century system based on the latest technology. According to one study, just by transferring medical records from those yellowing old pages in a file cabinet to an electronic record on computers, we could save $77 billion a year. And we can save lives too by reducing deadly medical errors, ensuring the doctors and nurses spend less time with paperwork and more time with you, the patient. Number four, we'll reduce the cost of our care by improving the quality of our care. It's estimated that poor quality care, from medical errors that cause complications to poor hygiene practices that cause infections, cost up to $100 billion a year. So we're going to provide you with information about your hospitals and providers' quality of care. We'll track which drugs and procedures work best. We'll reward providers not just for the quantity of services they provide, but for the quality of the outcomes for the patients. So you'll get better care, and we'll all save money in the long run. Number five, we're going to reduce costs for businesses and their workers by picking up the tab for some of the most expensive illnesses. Right now, the 5% of patients with the most serious illnesses, like cancer and heart disease, account for nearly 50% of healthcare costs. Insurance companies devote most of their expenses to these patients and then pass the cost on to the rest of us in the form of higher premiums. So under my plan, the federal government will pay for part of these catastrophic cases, which means that your premiums will go down. That means less money out of your pocket, out of your paycheck. So that's how we're going to cut costs. But that's not enough, because today, in the year 2008, 45 million Americans still don't have any health insurance at all. Let me see, raise your hand again if you don't have health insurance right now. 45 million Americans, some of them in this audience. This is one of the great moral crises of our times. And it's creating a vicious cycle that affects every one of us. As premiums rise, more people become uninsured. Every time those uninsured folks walk into the emergency room, because that's their only option, what do insurance companies do? They raise premiums to cover the costs. A hidden tax of $922 per family. Understand, if you've got health insurance, you're paying an extra $900 a year because you're helping to cover the cost for folks who don't have health insurance. And it ain't right. That extra cost means even more people can't afford insurance, so the problem just gets worse. We can't go on like this. This is not who we are, it's not who we have to be. That's why my plan will cover all Americans. And unlike Senator McCain, I'll do it by building on and strengthening rather than dismantling our current workplace-based system. So if you have insurance that you like, you keep that insurance. Don't listen to Senator McCain when he says, I'm going to put in place a government plan. That's just not true. If you have health insurance you like, keep your health insurance. If you have a doctor that you like, you keep that doctor. The only thing that changes for you, if you've already got health insurance, is that your health care costs will go down. That seems like a pretty good deal. Now, if you don't have health insurance, or if you don't like the health insurance that you have, you'll be able to choose from the same type of quality private plans as every federal employee, from a postal worker here in Virginia to a congressman in Washington, including myself and John McCain, have. All these plans will cover essential medical services, including prevention, including maternity, including disease management, including mental health care. No one will be turned away because of a pre-existing condition or illness. If you have children, they will be covered too. If you change jobs, this insurance will go with you. And if you can't afford this insurance, you'll receive a tax credit to help pay for it. And my plan also provides substantial help to small businesses to cover their employees. Small businesses are America's biggest job creator. Since 1990, companies with fewer than 20 employees have created 80% of new jobs in America. But today, too many small businesses are sinking under the weight of rising healthcare costs. My healthcare plan won't impose a single new burden on small businesses. Instead, we'll give them tax credits that will cover up to 50% of the cost of insuring their employees. So this will help them create not just new jobs, but good jobs, jobs with healthcare that stay right here in the United States of America. Now, I want to make one last point. I want to be clear about exactly how I will pay for my plan. Because McCain will tell you, oh, he's going to impose all these new taxes. First, I'm going to aggressively cut healthcare costs by reducing waste, greed, and paperwork. We're going to lower the cost of prescription drugs. We're going to eliminate wasteful subsidies to private plans in Medicare. And that's going to save a lot. But it will still leave a cost of about $65 billion a year. That's real money, $65 billion. So here's what I'm going to do. I will cover that remaining costs with a portion of the money that I save by ending George Bush's tax breaks for people making more than $250,000 a year. They'll go back to paying similar rates to what they paid when Bill Clinton was president. So we'll get this done responsibly without blowing a hole in our deficit. Now, I just want to see another show of hands. How many people are making more than $250,000 a year? Raise your hand. How many people are making less than $250,000 a year? All right. You will not see a single dime of tax increases. I just want to make that clear. You'll get a tax cut under the Obama plan. So don't let John McCain fool you with those TV commercials. Don't let him hoodwink you. Don't let him bamboozle you. Now, in the end, none of this is going to be easy. Look, we're up against a powerful, entrenched status quo in Washington. They will say anything and do anything and fight with everything they've got just to keep things the way they are. But you know, I know that if we come together, if all of us work together, black, white, Hispanic, Asian, Native American, young, old, if we all come together, we can do this. And so many people are counting on us. I want to tell you just a quick story. Just tell you a quick story. A woman named Robin, who I met in Florida. She's one of those people who need our help. Back in May, her 16-year-old son, Devon, came to one of our events. And I got to meet him at the airport in Fort Lauderdale. Wonderful young man. Later that day, the same day that I met him, Devon became seriously ill. His heart started racing. His lips turned white. He was rushed to the hospital and almost went into cardiac arrest. He was later diagnosed with a heart condition and told he needed a procedure that would cost tens of thousands of dollars. Robin's insurance company, his mother's insurance company, refused to pay. They said it was a pre-existing condition. And Robin's family just doesn't have that kind of money. But until Devon has that procedure, he has to take medication and stop all physical activity. 16-year-old boy, no more gym classes, no more football at school, no more basketball at the park with his friends. And after we met, Robin sent me an email in which she wrote, and this is what she wrote to me: "My son deserves all that life has to offer. Money should never determine the quality of a child's life. I can't help but feel as if somehow we failed Devon. Why couldn't we be the rich family that has the great insurance or could whip out 50 grand like it's nothing? She ended her email with these words: I ask only this of you. On the days where you feel so tired you can't think of uttering another word to people, think of us. On the days when you're playing basketball, think of Devon, who can't. When those who oppose you have you down, reach deep and fight back harder. Newport News today, I want to say to Robin and Devon and everyone like them across America, you have my word. I will never back down. I will never give up. I will never stop fighting until we have fixed our health care system and no family ever has to go what you're going through, what my mother went through, what so many people go through every single day in this country. That is my promise to you. And if you will stand here today, stand with me in this work, if you will talk to your friends and talk to your neighbors and get people to the polls and give me your vote, then together we will not just win Virginia, we will win this general election. And together, you and I, we will transform this nation and transform the world. God bless you. God bless the United States of America.